recording. Right. I am Dr. Megan Lippy. I'm one of the co-investigators with the End of Life Nursing Education Consortium. And with Dr. Davis, we support schools of nursing with their palliative care education. And we're thrilled to have you here for our last webinar of the spring series of ELNEC Innovations. We know this is a busy time for faculty with grading and graduations and all of those wonderful things. So we are thrilled to have you join us today. As we get started, we always like to know who's in the room with us. So if you don't mind dropping in the chat where you're joining us from, and also if this is your first webinar or if this is you're a repeat attendee, we always like to know who's joining us. So just so y'all know, the way we'll do this is we'll turn over to our speakers who will present this fantastic topic on the impact of the ELNEC online curriculum on undergraduate nursing students' confidence in providing palliative care. They'll present for about 45 minutes or so. We'll have time for question and answers. And then at the end, we'll wrap up with a few exciting announcements. So with that, I'm going to turn it over to Dr. Goodman for the presentation.
Hi, my name is Jolie Goodman. I am an assistant professor at Creighton University in Omaha, Nebraska. I've been in nursing education for about 15 years now, and I primarily work with students who are enrolled in our accelerated Bachelor's of Science in Nursing program and have been the course leader for the course where students first enroll in ELNEC and where we have a couple of the modules mapped to our curriculum, which you'll hear more about in our presentation. So that has been kind of my involvement with getting ELNEC integrated into Creighton's nursing curriculum.
And hello, I'm Dr. Mandy Kirkpatrick. I am the Associate Dean for Research and Innovation at Creighton University. My background is primarily teaching in the undergraduate program, and my dissertation was actually on the use of end-of-life simulation to promote primary palliative care competence among our students. And so I'm happy to say that since my dissertation, we've had end-of-life simulations and palliative care simulations in both our accelerated and traditional programs for all of our students. And really my passion for palliative care and wanting to ensure that our students are prepared led me down the path to learn more about the ELNEC online curriculum. And really, I took one of the leadership roles in getting this implemented within our curriculum across courses, and we'll talk more about what that looks like for us. I'm also happy to share that I am an ELNEC regional co-chair, so I'm happy to represent and support our Midwest region, many schools within the Midwest region, and how to implement palliative care education across your courses as well. So please feel free to reach out anytime.
And hello, I am Whitney Graaff. I am an assistant professor at Creighton as well. My background lies primarily in my clinical background in pediatric oncology as well as adult oncology. And so that's really where I, got my first introduction to palliative care. I didn't quite maybe feel the best prepared coming out of nursing school to care for patients in that capacity, but it plays a really, really large role in that population. And so that's why I've become a part of this team and bringing it to our students here at Creighton and really discussing the importance of it. And ELNEC has been a really great addition to our curriculum here at Creighton. I also teach in the courses where students experience the ELNEC modules. And so it's really been a great experience for faculty and students alike. All right, I think we can head to the next slide. Jolie, thank you. All right, so our objectives for this presentation, we're really going to discuss and describe how we at Creighton have assessed our pre-licensure nursing student learning outcomes using the Primary Palliative Nursing Care Competence Assessment Tool, or the PPNC CAT. And we're also going to talk about how we've utilized ELNEC's online modules through interactive and experiential learning to support primary palliative care competency development in our students. All right, next. Thank you. Okay, so the background of this project really begins with the American Association of Colleges of Nursing's, or AACN's, including care of patients and families during end of life in the essentials, and seen here kind of within the spheres of care. This requires all colleges of nursing to ensure that the principles of end-of-life care are adequately emphasized within Bachelor of Science in Nursing curricula. And several stakeholder organizations have also issued position statements calling for primary palliative care competence as a standard, stating that all nurses, regardless of care setting, must be trained to meet AACN's competencies and recommendations for educating undergraduate nursing students, and to meet the call for nurses as leaders in palliative care. So this growing need for palliative care competency partially comes also from our aging population and our increasing prevalence in chronic illnesses. The care of these individuals is happening across all settings. Often we're trying to keep them home as long as we can. And so it's important for nurses in any setting to have training in palliative care and feel comfortable in providing palliative care as soon as they step into the workforce. Some of the benefits of palliative care include improved quality of life, symptom management, patient and family support. Next slide. Some of the challenges in palliative care education and barriers to effective integration include an inconsistent quality and depth of end-of-life or palliative care content in nursing curricula. Some faculty may lack specialized training in palliative care and therefore not feel confident including such content in teaching and learning activities. An additional challenge includes time constraints within already packed curricula, making it really difficult to insert meaningful activities and content on palliative care. Along with this, there is difficulty in providing practical, hands-on experience with end-of-life or palliative care, as students may or may not come across such patients in their clinical experiences. Next, thank you. This brings us to ELNEC. ELNEC stands for the End of Life Nursing Care Consortium. It's a national project to improve palliative care education for nurses. They have several focused curricula, including the online undergraduate, new graduate curricula that we will specifically be talking about today. The curricula are built to meet the primary palliative nursing care competencies defined in the AACN's CARES document. A benefit of the online curricula is that the material is current and it's kept up to date by experts in palliative care. The ELNEC curricula is theoretical, it's application-based, and provides case examples and helpful tips that can be used in practice. Further, the ELNEC curricula addresses some previous barriers to incorporating palliative care education in nursing schools. The online format really helps to improve accessibility to geographically diverse and distance learners and allows for flexibility when adapting into current nursing curricula. And so the link to the website is on this page as well. Next slide. So the online ELNEC undergraduate new graduate curriculum contains 6 one-hour modules, and they are listed here: the intro to palliative nursing, communication in palliative nursing, pain management, symptom management, loss, grief, and bereavement, and final hours of life. Content within each of these modules helps to promote critical thinking and skill development, while also providing NCLEX-style questions and testimonials from palliative care experts. The faculty guide is a great resource in supporting educators with the implementation of these modules. It reviews each module's learning objectives, it provides support for the activities found within the modules, and gives ideas for how to incorporate the modules into coursework, including customizable case studies. Next slide. So as our institution began exploring adopting the ELNEC curriculum, we developed a core team of faculty with interest in palliative care to assist in the process. There were at least 2 faculty reviewing each of the 6 modules and exploring where they would fit best, both within our 4-year traditional BSN program and our 1-year accelerated BSN program. A helpful aspect of the online curriculum is that the modules do not need to be taken in sequential order, and so therefore we could really align each module to concepts and exemplars that were within our curriculum without concern of the order in which they needed to be completed. This helped to ensure seamless incorporation into our curriculum and the opportunity to really build some meaningful activities to support the modules and their associated concepts. The Introduction to Palliative Nursing module focuses on defining palliative care and hospice, and it supports the student in understanding the role of the nurse as a member of the interprofessional team in providing that palliative care for patients with serious illnesses and their families. So this one fit well within our client-centered care coordination concept, as you can see here. The Communication in Palliative Care module focuses on discussing the role of the nurse in effective communication with the patient and family and the interprofessional team. It also talks about the use of attentive listening and mindful presence as part of this communication. And so this really fit well within our communication concept. The Pain Management and Palliative Care module discusses the domains of pain and how they relate to holistic assessment. It also reviews pharmacological and non-pharmacological interventions to optimize comfort, and so this nicely fit well with our pain concept. And then the Symptom Management and Palliative Care module focuses on common symptoms and their etiologies associated with serious illness across the lifespan, along with the assessment of these common symptoms. And so this fit well within our stress and coping concepts, particularly within the exemplar of chronic debilitating disease. The Loss, Grief, and Bereavement module reviews the nurse's role in assessing and supporting grieving patients and families. It also addresses strategies that nurses and healthcare systems can use to recognize and respond to loss, grief, and bereavement. And so this, again, fit well within our loss and grief concept. Finally, the Final Hours of Life module reviews key concepts that are part of the end-of-life care as nurses guide patients and families in preparing for death, including addressing the holistic needs of the patient and family. It also focuses on care of the body after death, and so this really fit well within our spirituality concept, particularly within our exemplar of end-of-life care. And so you can see that all of the modules fell within our care management courses, which is where the students experience their clinical rotations as well as content within the classroom. We integrated the online curriculum initially like a textbook that students purchased with the rest of their items on their textbook list. However, in order to reduce the amount of time students are paying for items, we have now rolled the ELNEC curriculum into our student fees. And so attached on this slide is also a sample proposal template that your institution could use in the adoption and incorporation of the ELNEC modules. And this template can also be found on ELNEC's faculty corner site. Next slide.
So with the integration of these ELNEC modules, we set out to do a study. So the purpose of our study was to examine nursing students' confidence with palliative and end-of-life care after completing the ELNEC undergraduate and new graduate curriculum. Our study was set up as a retrospective pre-post evaluation design. And we did initially set up a true pre-test and post-test where we had students complete a different survey before beginning the ELNEC modules and then at the end. But we were using the CARES statements from AACN. Those contain 17 statements. And what we found was happening was students were rating themselves very highly at the beginning. And so it was difficult to see much growth because of their high rating ahead of time. And then also each of those competencies, each of those care statements has multiple concepts within each statement. So it was really difficult to tease out any areas of exceptional growth or lack of growth. So we changed the way that we were collecting some of this information. So with this retrospective pre-post evaluation design, students were sent a survey link at the end of the program, but before they completed an end-of-life simulation. And when they were sent this survey, they completed that PPNC CAT 2 times, once to reflect on their confidence before they began the ELNEC modules, and then again, answering that same tool and how they felt after completing the ELNEC modules. We know that simulation does impact student learning, and so we didn't want to have the simulation learning included in our results, which was why we timed it when we did. Our site was a Midwestern Jesuit university that does have 3 campuses, and again, had students enrolled in both that traditional and accelerated nursing program. And I'll talk a little bit more about the PPNC CAT here in a couple slides. And the reason that we use this tool is that while we know that palliative care outcomes include cognitive, psychomotor, and affective domains of learning, at our College of Nursing, we use objective instruments to assess students' cognitive and psychomotor learning. So for this study, we really wanted to isolate that affective learning, which does include students' self-efficacy. We included or invited students to participate in fall of 2024 and spring of 2024. And you can see those numbers there about how many students were invited to participate. And this PPNC CAT is a 33-item tool that has these competency statements that are divided into 9 domains. When students complete this tool, or anybody completes this tool, it's a 4-point Likert scale where they would rate themselves as either not confident, somewhat confident, confident, and very confident. So a little bit more information about this PPNC CAT. You can see the 9 domains listed there over on the left-hand side. There are a few domains that I'm going to talk a little bit more in depth in our results just because of some of the way things turned out. So I'll just highlight those sections here. One of those is communication. So that one has 3 statements about presence, therapeutic communication, and serious illness. Education is another one I'll talk about a bit more later. And that one has 3 statements about important elements of education about serious illness or injury. Care nearing end of life is a domain that has 2 statements about assessing patient and family preferences for care and adjusting care to changing needs as death becomes imminent. And then self-care and reflection is a domain that has 4 statements about self-care, reflective practice, and other aspects of lifelong learning. When it comes time for our results, we did also collect some demographic information. We had 292 participants complete the survey. 186 of those were enrolled in the accelerated program, while 106 were enrolled in the traditional program. And most of our participants were 25 years of age or younger. They were female and white. Considering the participant age groups in relation to the, we asked participants if they had any experience with death or end of life. You can see those results down there at the bottom. And considering the age groups in relation to the experience with death questions, there was no statistical difference between the groups. And while fewer than half answered yes to dealing with loss of a loved one in the past year or caring for a loved one who died, most participants did report caring for patients at the end of life. These graphs here show, they divide out the accelerated is what's on the top there, and then traditional is on the bottom. And for each of the domains is the different color. The pre-test results are over on the right-hand side of each of those, while the post-tests are over on the left. So you can see through that graphic, the increases that we did have in the students' mean confidence. So there was a significant pre versus post interactions between traditional and accelerated nursing students. You can see your p-value there of 0.003. This was a readily apparent increase between pre and post confidence ratings, which was essentially equal to the students transitioning from being somewhat confident to confident across all domains and in both of the programs. Now, individuals with experience with death did rate themselves as a little more confident than those who reported no experience. And an interesting thing to know is that on post-course confidence ratings, the accelerated nursing students rated themselves significantly higher than traditional students in all domains. To highlight a couple areas of growth, I mentioned a few of those domains, so I'm going to highlight a few of these here with where some of the biggest growth was in our pre-course and post-course survey results. So pre-course, the lowest domain mean was education, while the highest was communication. And then at the end, when the students were reflecting on how they felt after completing ELNEC modules, the lowest domain mean was care nearing end of life, while the highest was that self-care and reflection. So the greatest percentage change and the largest difference in confidence was in the education domain. Again, it was the one that started out the lowest at that 2.15, and it increased to 3.19 at the end of the ELNEC modules. And then the smallest percent change was in confidence in that communication domain. And the communication was the highest one pre-course, starting at that 2.40, and then at the end it was at that 3.21. The smallest difference in confidence was in the care nearing end of life domain. The Cronbach's alpha that we had for the PPNC CAT for this study was 0.987. And this tool had not previously been used in a self-assessment type of study. So that's good information for future studies. And I'll let Mandy talk about our discussion of findings here.
Yeah, so just revisiting these results and kind of discussing, back when.
Sorry.
It's okay. There we go. Awesome. As we said, our study did find that students with personal and professional roles, that the ABSN students demonstrated higher confidence in those post-ELNEC course evaluations. And so our study found that students with personal or professional loss actually rate themselves as more confident in that primary palliative nursing competence, and that these ABSN students may even benefit more from the ELNEC curriculum, perhaps due to their age. So traditionally our accelerated students are, and you can see that in our demographics, are older by several years in comparison to our traditional students. They also generally have greater prior experience. And so these were not statistically significantly different between the traditional and ABSN students, but it is worthy to note. What's interestingly, we did read in another study by Lin et al. That they had similar findings among their accelerated BSN students in their study, which could reflect that life experience and professional maturity are contributing factors to that self-perceived primary palliative nursing competence. Additionally, Lin et al. Did some qualitative analysis and found that to support the suggestion of experiential learning and actually driving the impact of primary palliative care content. So that experiential piece is important. When we talk about the area of greatest increase, which was in educating patients and families about palliative care, this, may be because students pre-course lack of awareness or experience in actually teaching others about palliative care content. And so that may be why we saw those significant gains. In communication, which was, again, the lowest increase, keeping in mind that students also reflected that this was the domain where they had the highest level of confidence before even engaging in the ELNEC curriculum. So that makes those gains harder to detect. Additionally, when we look at those specific items in the communication domain, these emphasize the use of therapeutic presence, compassion, and respect, which are also core values of the Jesuit institution where our students study, and so thus may have been well integrated into curriculum and content before even engaging in the ELNEC curriculum. Again, the highest post-test score was in self-care and reflection. And what's really unique about the PPNC CAT instrument is that it moves beyond purely patient and family-focused items to include that domain of introspection, allowing nursing students to evaluate their own skills in self-care and reflection. And this emphasis on evaluating nursing coping skills is really essential in promoting the health and sustainability of our nursing workforce, especially in the area of primary palliative nursing competency, because we know that managing and caring for patients with serious illness and the complexities that occur can sometimes lead to burnout. In this study, the domain of self-care and reflection scored highest among students' completion of the ELNEC undergraduate curriculum, aligning with another study by Farrell et al., which found and emphasized the importance of preparing nurses to cope emotionally, particularly in the area of palliative care. And again, just revisiting that lowest post-test score. So these were lower scores on pre-test as well as low on post-test. And when we look at that tool, the PPNC CAT, what's interesting is that Lippi and Davis really designed the tool to help us as educators in identifying programmatic concepts and curricular gaps. And so its use in this study reinforces that this does help us in understanding our curricular opportunities. So this domain of care nearing end of life being the lowest area is consistent with other studies, actually, where they found among nurse residents that this was the area of lowest confidence, which really indicates an opportunity to improve our learners' preparation for their roles in assessing patients and families' end-of-life preferences and in preparing them for the rapidly changing needs of imminent death beyond the ELNEC modules. Like, it's really important, particularly maybe through experiential learning, to expand beyond those ELNEC modules in this area. Next slide. When we talk about the PPNC CAD and just in light of the current studies that exist, one thing to note is just the tools that we use for primary palliative nursing competency assessment. There's really a variety of tools that exist. And these have different measures. We might measure knowledge, attitudes, or perceived competence. However, the relationship between these constructs of competence remain theoretical and really need to be tested and validated with reliable instruments. When we dug into the literature, we were able to find 7 studies that evaluated the use of a variety of ELNEC online curricula, primarily the undergraduate and new graduate modules. What was similar about our study to previous studies was that we all used a single assessment tool to evaluate learner outcomes with no correlational analysis between other constructs of competence. And in most of these studies, faculty-developed questionnaires were used most often to assess student satisfaction or their comfort level with palliative care content, either on a 4.5-point or 10-point scale. And there was only one previous study that utilized an actual validated tool to objectively measure student knowledge and perceived preparation for primary palliative care. Among these 7 studies, schools really varied in their integration of the ELNEC curriculum, with some threading the modules across multiple semesters, while others incorporated all of the modules within a single dedicated course. Some of them used the curriculum as an asynchronous online-only assignment, where there were others who used it as a flipped class approach, where they engaged the students in active learning as part of a simulation experience, maybe a clinical conference, and definitely emphasized the use of debriefing to help assimilate the content through case studies and other methods. Most of the studies required module completion, while there was one study where students voluntarily completed the modules. And in most of the studies, the modules were integrated into an accelerated BSN or an associate degree nursing program, with just one study of students in nurse residency, making this really the first study to what we could find where a 4-year traditional BSN program was included in the assessment of the ELNEC program. It also was the first to use the PPNC CAT as a summative evaluation of the ELNEC undergraduate and new graduate curriculum as a measure of self-perceived confidence in students' primary palliative nursing care. And as Jolie mentioned, the tool demonstrated a high internal consistency reliability within Chromebox Alpha of 0.987, which really supports the use of this tool in measuring the intended concept of primary palliative nursing competence. Next slide. So what are the implications of our study? Well, we find that ELNEC is a very effective learning tool which improves nursing students' primary palliative care confidence and really supports the integration then of this ELNEC online curriculum into undergraduate nursing programs. When educators are implementing the program, they should consider the impact of student age and experience with death on their confidence and competence, as well as the importance of providing opportunities for students to gain experience with palliative care. Reinforcement through interactive and experiential learning supports student knowledge and enhances the curriculum's impact. Specific opportunities for reinforcement include patient education earlier in nursing programs, especially educating on the difference between palliative and hospice care and what palliative care is, as well as emphasizing patient care when they are near the end of life. Care in those final hours was noted as an area of low confidence in multiple studies, thus education on the signs and symptoms of imminent death and rapidly changing needs of patients at the end of life should be augmented through application exercises and experiential learning. Next slide. There were a number of limitations of our study. First, the retrospective pre-post evaluation method that we used really relies on students' memory and self-perception of their growth because they are taking this survey after they've engaged for a year or even 18 months in the module completion, which may not accurately reflect their actual knowledge or skills in end-of-life care or their initial competency levels. Additionally, reliance on this retrospective data can be susceptible to subjective bias and recall, as students may over or even underestimate their confidence and knowledge levels. And palliative care experiences can be emotional and can affect students' ability to accurately remember their initial levels of confidence. In addition, they may be influenced by wanting to report growth in their skills and knowledge. So maybe they were trying to appease the educators in the impact of the program. Thus, self-perceived confidence may not reflect actual competence. Also, this was a single institution study, which limits its generalizability. The sample for this study was from a program with 3 campuses in Nebraska, Omaha, and Grand Island, and in Arizona, in Phoenix, and included students from both an accelerated and traditional BSN program. While the inclusion of having students in both traditional and ABSN programs really might enhance its generalizability, the study sample was only of nursing students at one Jesuit university, so it may not be applicable to other programs and institutions that are not faith-based. Therefore, future multi-site studies should include students from a variety of educational programs and educational institutions to validate these results. Next slide. In thinking about what we can do and where there are gaps and opportunities for future research, there's really an opportunity, again, to explore the effectiveness of ELNEC in diverse settings and institutions, to conduct pre- and post-intervention evaluations with some long-term follow-up. How are students retaining this information over time, and is it really following them into their clinical practice? Investigating the impact of ELNEC on actual clinical practice. So, are we impacting patient outcomes? Are students who engage in and complete these modules demonstrating greater palliative care principles in their practice and improving patient outcomes? And then examining that relationship between confidence and competence. Again, these are really theoretical constructs, and we need to prove those relationships with effective studies and validated and reliable tools. And last slide. And so final conclusions, ELNEC empowers nurses, and it's so important that we empower nurses for palliative care. ELNEC significantly improves nursing students' confidence in providing primary palliative care. Integrating ELNEC into the nursing curricula is really essential for preparing future nurses. However, further research is needed to explore the long-term impact of the ELNEC curriculum overall. And we're now happy to take any questions from the group. And thank you so much for giving us this time today to present on our study.
Thank you all so much. This was a fantastic presentation. At this time, again, we are open for questions. So you are welcome to write your comment or question in the chat if you're preferred, or if you want to raise your hand, we can call on you and you can open up your mic and ask your question to our team. And while you're thinking of those, one thing I want to speak to is you mentioned the importance of experiential learning. And that's a message that Dr. Davis and I like to communicate a lot, is that having the students complete the module is a great foundation. However, they have to actually be able to have experience providing this care and getting feedback from faculty on their actual competence, like how they actually were engaging with those patients, whether it's simulated or in real world settings. So even with the PPNC CAT, the tool that they used, one of our antecedents, or one of our precursors, I should say, one of the requirements for assessing competence for students is they have to have had experience to or exposure with primary palliative care provision. If they've not had any engagement or interaction with that, how can we assess competence? So it is important that faculty think beyond just completing the modules, checking a box, and that's it. There has to be more augmentation, I think Dr. Kirkpatrick used within the curriculum. Pam.
I really appreciate your comments, Megan, about experiential learning and how important that is, because some of the feedback we get from our students about our palliative care course is because they're taking it while they have other things. Oh, couldn't we just do this online? You know, and to do it fully online just really takes away from that experiential piece. And you just can't learn some of these things like sensitivity to talking with a patient who's just gotten bad news by reading it. So these things help us be able to defend why we need that face-to-face time. I appreciate that.
Thank you. Other questions from the audience or comments or ideas that you're using in your institution for experiential or competence assessment?
I think I see a question in the chat.
So during which semesters of your ABSN and TBSN programs do you include the ELNEC undergraduate modules? And then what other content does Creighton include elsewhere? So a bit more about perhaps your integration approach.
Yeah, so I don't know, Jolie, if you want to jump back to that slide, but in the traditional BSN program, we integrated into what we say are our care management courses, which really are our clinical semesters, right? We have 3 clinical semesters, and then they have a final preceptorship semester. So they technically have 4 semesters in which they are engaging in the clinical setting. And so the first 2 modules are in their first clinical semester, which for most programs would equate that to their first semester of junior year, or fall semester of junior year. And that's for our traditional students. And then Whitney, do you want to speak to the accelerated students?
Yes, so the accelerated students, it matches with the care management courses there, but with it being a 1-year program, they enter into using these ELNEC modules fairly early on. And Jolie's more familiar with the ABSN curriculum than I am, but it's additionally in their Care 1 course. And so theirs really spans nearly the full year that they're in the ABSN curriculum.
Yeah, I think that it's like term 2 is what we call it in our ABSN curriculum, which is about 12 weeks into the program, so 3 months. Yeah. So they complete all of those modules in about 6 months' time, I think, because they do wrap them up before their final preceptorship term, maybe just over 6 months, whereas the traditional students actually are engaging in the modules because our traditional students have their summers off. So they engage in it in the fall, the spring, and then they take a break during the summer, and then they finish up the modules in fall. So it's almost an 18-month time span that the traditional students are doing. And then Whitney, did you want to speak to that second question?
Yeah, our care management courses essentially are med-surg courses. Yes, they get med-surg content within these courses, but we are concept based, and so it really covers all across the lifespan, including into critical care, ICU care, once they get into their senior level courses.
Yeah, so I would say our clinical rotations that accompany the didactic portions of the care management course, I shouldn't say rise in acuity, because actually in that very first semester they do labor and delivery, which includes our high risk OB, and even some neonatal content. But in that first semester, their rotations include a community health, particularly in the school health setting. So they get some pediatrics there. They do their very first medical surgical rotation, although it's more in a subacute rehab settings, I believe.
Yep.
And then again, that OB setting. So those are the 3 rotations in that first semester. In the second semester, they do mental health, med surg in acute setting, and pediatrics. And then in their final clinical rotations, they do multiple client in the medical surgical setting. So trying to increase care, care of complex and multiple patients, as well as doing ICU and emergency department rotations, as well as some additional population health focus.
There's another question about seeing a course with all 6 modules as a summer elective with a practicum component added, and wondered if any of y'all have thoughts. I could chime in, absolutely, but I want to see if our speakers have thoughts first.
So we don't have an RN to BSN program anymore. We used to. And we integrate the modules across multiple semesters, but in looking at the studies that have been done, they were able to integrate all 6 modules into a single course. And in fact, the course even had the students complete it within like 4 weeks. And they still found that the course was effective in that way. And so that's what's really wonderful about the ELNEC curriculum, is it's so flexible and adaptable to your curriculum. You don't there's not one right answer. Just having the students engage in it clearly is a benefit to them. But then I think, again, to Megan's point, experience. It's while there are programs that implement it sort of as an online only without that experience piece, and Pam highlighted it as well, it's so important that we are assimilating and augmenting those modules with some experiential and in-class discussions and so forth.
And I will add too, we have colleagues across the country who have had a desire to integrate palliative care and work, as a first step to trying to make it required for all students. They did go the route of having an elective course, and we're very intentional in trying to gather student outcome data that they could take back to the curriculum committee to show the impact on students, the benefit for students. And so that has been a successful endeavor for many schools. We have colleagues who've shared that having an elective actually was a great first step to now it's a required course in the curriculum, or faculty have seen the value and are now integrating it in other courses. So absolutely, that's something that can be done. And also with an RN to BSN, one of the things that we have to consider is while they might have, they often have nursing experience, they may never have gotten that actual formal education in primary palliative care. It might be more on the job training experiences. And so they would benefit from this curriculum as any other nursing student would, because we want to make sure that they've had that really robust introduction to palliative care content. All right, there's another question about were the clinical faculty involved in reinforcing the concepts taught in the modules?
So I can speak to that. For this study, we did not include clinical faculty specifically in reinforcing the concepts. However, many of the faculty who are integrating these ELNEC modules into their courses kind of cross over and may have students in clinical as well. So it wasn't an intentional part of our study, but faculty who use these concepts in class also interact with the students in the clinical setting.
And then I'll just add that we do have a palliative care simulation at the end. So after they've completed all of the modules, and that simulation technically is a part of the clinical course, and all of the students engage in that simulation. So if the clinical faculty haven't reinforced, those are certainly reinforced in that final sort of capstone simulation for end of life and palliative care.
Wonderful. There's a question that came to me, but I think the answer would benefit everyone. So this was a little bit more about the modules themselves. So within the ELNEC undergraduate, new graduate curriculum, as our presenters mentioned, there's 6 modules. Students do have to progress through that module. Each module is built so students can't just rush through it, that there are some interactive features. When there's videos, they can do like a 2 times speed, but they cannot just go to the end. They actually have to watch it. There's reflection questions throughout, there's knowledge checks throughout, but then every module concludes with a knowledge assessment, and students have to achieve an 80% score or higher on that knowledge assessment to earn their certificate of completion. Now, once they get the 80%, they cannot go back in and try to get a higher score. So we really encourage faculty to not give them the score that's on that knowledge test, but to use the certificate of completion as maybe a ticket to entry for a simulation or as a course assignment. But they do get a certificate of completion after they've achieved that 80% score. And then the question sort of asking before they move on to the next one, every module can be standalone and provided whenever you want to in your curriculum. So they are not required in sequence by any means. So it's just each module ends with that knowledge assessment.
And I know that some people joined us late, so you may not have seen or heard us talking about the order that we actually do the modules in. And so you can see that here on this slide, but what is actually intended to be the first module, or is the first module in the curriculum, is one of the last modules that our students take, because the concept of client-centered care coordination, which aligns very closely with palliative care and what is in that module, lands at the senior level. And so our students have taken modules 2 through, I think it's 2 through 5 before they actually take module 1. And it's worked really well for us because, again, we're concept based, and we really believe in scaffolding content and extending upon those basic concepts. So
wonderful. Thank you all so much. In the last few minutes, I do want to share a few resources and actually signal back to some of the resources that our presenters shared. So I'm going to steal the screen here and show, hopefully y'all are seeing our ELNEC faculty corner. So this is our ELNEC page dedicated to all things schools of nursing. We are housed on the AACN website. So if you see AACN, you're not in the wrong spot. You are in the right place. But in our faculty corner on this landing page, there's a few things I want to mention. Dr. Kirkpatrick mentioned she's one of our regional supports, which is true. We have under this regional support section, we have regional chairs who support different states. And if we don't have a regional chair for state, Dr. Davis and I support those states. So you can go to this page and find out who that person is for your area. Also want to mention, let me go back to the main page here. The integration tool that the Creighton University generously shared with us. If you go to our faculty corner under resources, under the teaching tab at the bottom, they actually provided that template. It is a fantastic proposal. I used it at my own institution where I am now to get it integrated. They provide fantastic rationale. So the things you would need to tell your curriculum committee to get them on board, they've already written for you. So really what I had to do was just say where I wanted the modules and in which course. So fantastic template there as well. Dr. Kirkpatrick mentioned simulations, and we do have many different teaching resources that have been shared by colleagues throughout the country. Simulations, there's about 10 of them. Some of them are provided by Dr. Kirkpatrick. Those are some of her interprofessional simulations, so I encourage you to check those out. Also, the tool that they use, the PPNC CAT, if you go under our evaluation resources, it is under palliative care competence. And Dr. Davis and I make this freely available. You click this link. It's a very quick Qualtrics survey where we kind of give you some some guidelines for how to use it, and then it gives you the tool to use with instructions and that sort of thing. So absolutely, anybody could use it. We also have other information about reliable, valid evaluation tools here. There's also been a publication that came out recently from our regional chairs about, it was a literature review of all of the reliable, valid instruments we found to evaluate student learning outcomes in palliative care. So if you're looking for ideas for evaluating outcomes, encourage you to check out that reference. It's got a table of tools across cognitive, affective, and psychomotor domains. So lots of great resources. The last two things I want to mention here. First is at the very beginning, one of our speakers mentioned, a barrier is some faculty don't know about palliative care. So we do have our clinical courses. These are courses that are train the trainer, but you come and you learn about what is palliative care, and then you get the resources you need to take that back to teach in clinical settings. We do have an oncology APRN. So if you're in oncology practice, that course is still open. And even though the deadline is passed, we still have spots. So our team asked that I share that is available. And we have a summit coming up in Chicago where we offer all of our clinical courses. So if you're wanting to learn more about palliative care specifically, highly encourage you to attend a summit. And then also, last place, I know that's lots of jumping around, but lots of great resources. Under our upcoming events, if you go to the view schedule, under upcoming workshops, we have a summer workshop, and I see we have a lot of first-time attendees, which is wonderful today. We offer a 2-day workshop for faculty. This year we have tracks for undergraduate and graduate faculty, and it is grant covered. So the only cost to you as a faculty participant is travel and dinners. So we cover registration, we provide lodging if you're willing to stay in the dorms. It is so much fun. CEs, breakfast and lunches, all of those things. It does look like tomorrow's the deadline, but that's not true. We do have a few spots left, and we are happy to continue to accept applications. So if you want to attend the summer workshop, it's in July at the University of Portland. Please know we are still accepting applications. So you can go to our Faculty Corner website under upcoming events and find out more about what it is, what the objectives are, all of those good things. But please know we will continue to accept applications until all of our spots are full. So definitely a first come, first serve. So if you're wanting to come and get one of those few remaining spots, apply sooner rather than later. But yes, we are still open for accepting applications. I think that was all of the things I was going to share. Faculty do get free access to our ELNEC undergraduate curricula or the graduate. And to request it, you just email ELNEC, and I could put the email in the chat here in a second, but elnec@coh.org. And when we send you the information with your free access, we also send the faculty guides that were mentioned, which are for undergraduate, for every module, we have a compendium of application-based activities. There tend to be about 20-page documents for each module. So it's basically, instead of you having to figure out the experiential learning, we give you lots of ideas to start from, lots of digital resources, lots of things, case studies, all that jazz. And then you can just take it and run and do what you want with it. And we organize it to align with the outline or the structure of the modules to try to make it easier. We are building those for graduate, and those will launch this summer. So highly encourage y'all to think about it. I see some people saying the dorms were great. Yes, we are moving to more traditional dorms this year. We were in apartment style, but the workshop's so popular, we need more space. So we're going to be in like legit, dorm housing. It's going to be fantastic. So with that, I want to just thank our speakers. Any last thoughts from you before we conclude?
No, just thank you again for the opportunity and for us to share the great work from our team.
And also, these speakers we have a special issue coming out in the Journal of Hospice and Palliative Nursing in November, December. That is all things school nursing. And this team is going to have an article where they present these results. So we're excited to see that. So if you want to get it in writing and learn more, be on the lookout for that November, December issue. Which we'll send out information about through ELNEC's different communication platforms. So All right, with that, we will conclude. Thank you all for attending. This concludes our spring series. We will start back up in the fall. We want people to enjoy their summers, come to the workshop, but then we'll kick back up with new webinars in the fall. We'll announce those kind of closer to the fall semester starting. So thank you to our Creighton team, and y'all have a great rest of your semester and summer.